Have you ever felt one of your fingers get stuck in a bent position and then suddenly snap straight like a trigger being pulled? If so, that might be something called trigger finger. My name is Nick Parmigiano with Treasure Coast Physical Therapy and Fitness, and today I want to break down what trigger finger is, why it happens, and what treatment options are available to help you restore normal hand function and relieve pain. And trigger finger, also known as Stenosing Tenosynovitis, happens when the tendons that help your fingers bend and straighten become inflamed, irritated, or thickened. Normally, those tendons glide smoothly through a protective sheath held in place by a series of pulleys, but when the sheath becomes narrowed, usually at the base of the finger, the tendon catches, causing the painful locking or snapping sensation. Some of the common symptoms of trigger finger include catching or locking when bending or straightening the finger, pain or tenderness in the palm at the base of the finger, so right about here, stiffness, especially in the morning of the fingers or the hand, a popping or clicking sensation, and in more severe cases, the finger may actually get stuck in a bent position. Now, you're more likely to experience trigger finger if you do repetitive gripping or hand-intensive work, if you have diabetes, rheumatoid arthritis, or gout, if you're middle-aged or female, or if you have conditions like carpal tunnel syndrome already. The good news is that treatment is often very successful, and some treatment options include conservative care like rest, activity modification. You can splint the hand or the finger often at nighttime to keep the finger straight. You can take NSAIDs for pain and inflammation. Those are non-steroidal anti-inflammatory drugs. Learning how to stretch or glide the tendon with exercise. You can take corticosteroid injections, which can provide relief for weeks or even months. And the minimally invasive options are something called percutaneous release, which is a needle procedure done under local anesthesia to release the tight pulley. You can also have surgical release, which is a small outpatient procedure to release the pulley, which is highly effective for severe or more persistent cases. Now, if your finger is locking, catching, or painful, don't wait for it to get worse, because early treatment can prevent long-term problems and avoid surgery in many cases. Just call us at 772-485-9447 so we can get your hand moving comfortably once again so you can get back to doing what you love.